Hi guys, Rachael Cook, Doctor of Audiology at Applied Hearing Solutions in Phoenix, Arizona. And in today's video, I'll be reviewing everything you need to know by the end of your first year wearing hearing aids. Coming up. Hearing treatment is a continuous process, and there is a lot to be done over your first year wearing hearing aids in order to maintain the maximum benefit possible from your devices. But it can be difficult to know just where you stand in this process and if you are where you should be in your hearing treatment journey. That's why I started the Everything You Need to Know series, to make it easier for you to know what to expect from hearing treatment from start to finish. In my last 4 videos of this series, I covered everything you need to know from your hearing evaluation and consultation to your hearing aid fitting and your follow-up appointments during your fitting period. If you haven't seen those videos, make sure you check out this playlist that will guide you through each and every step. But at this point, you have been wearing hearing aids for a year and are a seasoned hearing aid user. That's why today I'll be reviewing everything you need to know by the end of 1 year wearing hearing aids. But before we do, if you could please take a moment to give this video a thumbs up, it brings videos like these to a wider audience. And if you haven't already hit that subscribe button with notification bell, make sure you do that too so that you never miss any one of our newly released videos. We really appreciate it. Now, let's review some of the things you may have experienced during your first year of wearing hearing aids. Your first year wearing hearing aids requires a significant commitment of both time and energy, learning and practicing everything you've been taught throughout this process. But the rewards of your time and effort include better hearing, improved communication with friends and family, and heightened enjoyment of the things most important to you. Every seasoned hearing aid user develops a routine with their hearing aids, and after 1 year with your devices, wearing them nearly all waking hours should feel like second nature. Now that you are through the initial adaptation period, you should be seeing noticeable improvements in both simple and challenging listening environments. You should feel confident in the care and maintenance of your hearing aids, know how to address minor troubleshooting concerns, and have an excellent grasp of your manual or app-based controls, such as changing volume or switching between programs. You should feel comfortable with how to pair your hearing aids to mobile devices and your app, and know how to troubleshoot in the event that they become disconnected. During your initial fitting period, you should have seen your provider at least twice to optimize your hearing aid performance. But over the course of the year, you should have experienced at least one mid-year checkup appointment, sometimes referred to as a clean and check, in order to maintain your level of performance. During these appointments, your provider will check in with you to ensure that your hearing aid performance remains optimal. If you have any questions or concerns about your treatment, this is the time to address them with your provider, as it is their job to make modifications as needed based on your feedback. During this checkup, they will also perform a visual inspection of your ear canals to see if any earwax has accumulated, and if so, they should be able to remove this in office for you. Earwax can greatly reduce hearing aid performance, and if significant enough, can block your ear canal entirely, causing a temporary hearing loss. If your provider identifies significant wax buildup since your last appointment, they may recommend more frequent follow-ups to ensure that this never impacts your hearing or causes any damage to your devices. During these follow-ups, your provider will also perform a listening check of your hearing aids to ensure that they have an appropriate sound quality and volume. This is also the perfect time for them to complete a thorough cleaning of your devices using equipment that you may not have access to at home. In-office cleaning allows your provider to ensure that your hearing aids are in good working order, and also to identify if there are any gaps in your cleaning and maintenance routine that require addressing. For example, this clean and check procedure could reveal some moisture in the battery compartment of your devices that you didn't even know was there, but that over time could greatly compromise the function of your devices. Your provider will then re-instruct you on any key points of maintenance and suggest additional methods to extend the life of your hearing aids for years to come. If you wear your hearing aids for 10 hours a day, over the course of a year, you will have worn your hearing aids for nearly 4,000 hours, making this the perfect time for your annual checkup. Since you have worn your hearing aids so much over the course of the last year, it is critical to ensure that your hearing aids are mechanically functioning properly. After a detailed cleaning of your hearing aids in office, test box measures should then be completed. This procedure is called electroacoustic analysis and involves the use of a hearing instrument test box to run several different diagnostic measurements. Similar to a diagnostic check of your vehicle, this testing ensures that your hearing aids are meeting manufacturer specifications. Because devices can suffer mechanical failures slowly over time, We often find devices well outside of manufacturer specifications at patients' annual visits that the patient was not even aware of. But just as device functioning can degrade over time from wear and tear, so can your hearing. For this reason, it is in your best interest to receive an annual hearing evaluation to assess the outer ear canals for any earwax buildup and to monitor the stability of your hearing loss. Annual examinations are also crucial for individuals with diabetes, heart disease, or kidney conditions, as these are associated with more rapid rates of hearing decline. If you have not experienced a significant change over the last year, you may elect to have a hearing test completed every 2 to 3 years or sooner if you notice any changes. If this evaluation has revealed a change in your hearing, it may be necessary to perform reprogramming and real ear measurement to ensure that your hearing aids are still programmed to meet your hearing loss prescription. Depending on what your provider finds during this appointment, they will then be able to make their best recommendation on your follow-up frequency moving forward. Except for special circumstances, you should be seeing your provider no less than twice per year for continued comprehensive hearing treatment. However, there are some things that should never wait for your next scheduled follow-up, including any ear discomfort, any sudden or significant changes in your hearing or tinnitus, any noticeable changes in hearing aid performance, and if you need any maintenance supplies, as it is very easy to order incorrect parts online. In summary, here is everything you need to know by the end of 1 year wearing hearing aids. You need to know that your hearing aids are comfortable, secure, and being worn nearly all waking hours. You need to know what controls or features are available to you and how and when to utilize them. You need to know that your hearing aids are meeting or exceeding your communication needs. You also need to know that your ear canals are free and clear of earwax, or that a cleaning schedule has been established to avoid wax buildup. You need to know that your follow-up schedule has allowed for the professional cleaning and maintenance of your hearing aids. You need to know that your follow-up visits have revealed any weak points in your current maintenance routine and led to instruction of how to improve this. You need to know that your hearing aids have been put through test box measures and are meeting manufacturer specifications. You also need to know if your hearing loss has remained stable, and if it has not remained stable, then you need to know that the programming of your devices has been modified to meet your prescription using real ear measurement. And finally, you need to know that you and your provider have determined the appropriate follow-up schedule for you moving forward to ensure you receive the maximum benefit possible from hearing treatment. In conclusion, high-quality care requires a high-quality hearing healthcare professional committed to following the steps to have you hearing your best. If you want to find a hearing care professional who follows best practices and will take the time necessary to deliver this high-quality care, check out hearingup.com. Hearing Up providers are committed to following comprehensive best practices to ensure you receive the maximum amount of benefit from your hearing treatment, and will educate you along the way so you understand your entire treatment journey. That's it for this series on everything you need to know throughout your first year of your hearing treatment journey. If you liked it, make sure that you give it a thumbs up and share it with someone that you feel could use it. And if you haven't seen the other videos in this playlist, make sure you go back and watch them so that you know exactly what to expect at each point of the hearing treatment process.